Hello, everyone, and welcome to today's webinar, Clean It Like You Mean It, Introducing Vashe Wound Solution. Before we get started, I'd like to go over a few items so that you know how to participate in this event. We've taken a screenshot of an example of the GoToWebinar attendee interface. So you should see something like this interface on your own computer desktop. And you joined audio through your computer speaker system by default. But if for some reason you'd like to switch over to the telephone, click on phone call and the dial-in information will be displayed. If you have any technical issues, you can type those into the questions box, which is right here. And this is also where you would type your questions in for our presenters. So you can type those questions in throughout the presentation and we will address them during the Q&A portion. There are a few handouts that we provided, and you can access those by going to the handout section of the control panel. So to open them and save them, you'll click on each title. They'll open up in a separate window, and from there you can download or print them. I would now like to introduce our presentation, which is featuring Kara Couch and Allison Lachaine. And Kara graduated with her Master's of Science in Nursing from Georgetown University in 2002. In 2004, she became a certified wound specialist by the American Board of Wound Management. Her primary wound interests are in amputee care, wound infection, and venous ulcers. Currently, Kara works as an NP in the Wound Healing and Limb Preservation Center at George Washington University Hospital in Washington, D.C. She is an assistant research clinical professor at the School of Medicine and Health Sciences at George Washington University. Allison Lachaine has been a registered nurse for 13 years. She completed a Bachelor of Science in Nursing degree from Trent University, a Master's of Nursing from Charles Sturt University, and the International Interprofessional Wound Care course at the University of Toronto. For over 5 years, Allison has been the clinical nurse specialist for skin and wound care at Joseph Brant Hospital in Burlington, Ontario. Enjoy the presentation.
Welcome, everybody. We are here today to talk about Clean It Like You Mean It. This is a Vashe Wound Solution workshop. As you heard, my name is Kara Couch, and I'm very pleased to be with you and be with Allison today talking about Vashe. So, Clean It Like You Mean It. What does this really mean? So if you think about it, let's talk about something that has been so top of mind right now, which is very simple, but we've gotten much more meaning with COVID on hand washing in and of itself. So when you're washing your hands now, I honestly can tell you that I'm a nurse practitioner. I wash my hands constantly. I'm constantly foaming all throughout the day, but I didn't have it drilled into my brain as like this is a life or death, like I have to get germs off my hands type thing. And so there's this whole new mentality now about being very mindful of cleaning and being purposeful about it, and that it's effort, that you should be singing, the happy birthday song twice while you're doing really good hand washing, and that, we all walk around all day long with microorganisms and debris on our skin. But, it's really critically important to make sure that when we're talking to our wound care patients, that we are really washing and cleaning them to get rid of the microorganisms that's in their wounds themselves that are giving us such heartburn on the other side. So let's talk about an analogy about wounds. A day at the beach. Wouldn't we love to be at the beach right now? I grew up at the beach and have not seen one for about 9 months. So I'm really jealous looking at this picture. But when you go to the beach, what happens is you get really dirty, right? We get muddy. We acquire more stuff on our skin. So we need to take a shower or a bath to get clean. But we do more than just rinse off. You have to really get in there and get rid of like the grime and the nooks and the crannies. And you don't just want to use water or saline. You also would never ever want to shower with bleach, because then you would be doing something so caustic. It would be like, dropping a bomb on your skin. But, you want to get in there and scrub a dub and really combine the soap and water to get everything off and just, wash away everything that you picked up over the day. So if we did this for all of our patients, imagine what could happen. I've been doing wound care for 17 years, and a huge reason why is because wounds are chronic. They get more and more bacteria and more debris on the surface over extended periods of time. So if we could take that same analogy of being at the beach and washing away all of the sand and the dirt and the grime with our patients, this is the same sort of issue, right? Wounds are warm and wet. They get all kinds of bacteria kind of up on the surface. You get it kind of hidden, and it really makes kind of like a playpen for our patients when they have these wounds that are covered by whatever topical therapy that we have on them. But these wounds often have areas that don't get really cleansed and washed for extended periods of time. At most, you're probably changing and dressing twice a day, but are you really getting in there and like scrubbing everything in between that? So it takes much more of an effort to clean a wound, to get rid of the debris, and most importantly, the biofilm that is built up on the surface than it does for us to wash away just a day at the beach in the shower. So what can we learn from this? I want us all to have a new mentality that we need to treat wounds the same way as we would our hands or ourselves. And this is means to be very purposeful, meaning to scrub. You want to do sharp and soft debridement and soaking, because you need to saturate every nook and cranny within these wounds to get the bacteria and the biofilm removed. If we're not doing this, are we compromising the care of our patients? Are we compromising efficacy? Saline has been used largely because it has a safety profile when it's in contact with human skin, but it has no active antimicrobial properties. So therefore, it's not actually helping to penetrate through to the biofilm or the bacteria that's on the surface itself. If you were doing a soak with something like a sodium hypochlorite, which is bleach, this has antimicrobial properties. However, it's very harmful to human skin tissue. You would never do a sodium hypochlorite soak in the eyes or in your nose or the throat or genitalia. You would basically be burning the patient and causing a very caustic reaction. So what should we use when it comes to these patients? We need things that need to be effective. We want something that's going to mechanically remove the microbes and disrupt the microbes from reforming. And that's what's so beautiful about this, is that it removes the microorganisms and the necrotic debris on the wounds itself. This must be safe. We need something that's physiologically compatible, which is as safe as saline, but you can use it on any wound or anywhere on the body. And then also, it must be efficient. We can have patients that sit around in our hospitals for days and days and days because we're battling bacteria. But if we had something that would be proven to show that we can have faster discharge times, reduced operating room trips, and cost savings, well, that's a win-win. And we're going to go into that data in just the next few slides. Vashe does have all of these traits, and that's what we're going to be reviewing. So Vashe, the blessed blue bottle. How to use Vashe to clean it like you mean it. Let's get into it. What is in Vashe wound solution? So Vashe contains pure hypochlorous acid, which is a powerful antimicrobial preservative that is naturally produced during the oxidative burst pathway, which occurs when our neutrophils respond to invading pathogens. This is part of our body naturally, and the immune system uses it to eradicate bacteria. Vashe is manufactured at a pH no greater than 5.5, which even says it right there on the bottle. That is the same pH as healthy, healing skin. This can be used on essentially a wide variety of any wound that you can think of. Acute and chronic dermal lesions, pressure ulcers, diabetic foot, post-surgical, NICU skin, like sweet little neonates, and more. So why does pH matter? I've talked about that over the last couple of slides. It's a pH of no more than 5.5. Wounds heal best in an acidic environment. However, chronic wounds are alkaline. And then if you were taking something that had a pH of 10, which is what sodium hypochlorite does, has a pH of 10, you're not allowing for that balance to occur to get the wound to an optimal healing microenvironment. So as a result, you have higher levels of cytotoxicity, you're not getting rid of the bacteria, and you have a longer time using these higher pH solutions. So by lowering it down, you're eliminating the cytotoxicity and getting sporicidal activity, even more important. How would you use Vashe wound solution in your wound clinics or in your hospitals? There's multiple ways, and we're going to go through them. We're going to talk about soaking, packing, and installation. Now with soaking, it's very important to cleanse the wound and the peri-wound with Vashe. And this is what I do in my clinic. I work both inpatient and outpatient in a level 1 trauma center, where I previously, before I got into this facility, they were using saline to kind of get the wound wet and keep it calm so it didn't have any sort of pro-inflammatory pain from being exposed to the air. So they would saturate a gauze and place it on or in the wound, and you would soak it for as much time as available. So what we do is, as part of our routine in my clinic, our nurses or our MAs will take the dressings down, they will cleanse the area with Vashe, and then they'll saturate it and place it on the wound. And we like it to soak for at least a good 10 minutes before. At the very minimum, we like 5 minutes soak, but longer is certainly better for that. And then you will wipe the wound off from there, and you can actually remove quite a bit of debris from there. So, we have found a lot of benefits with doing that. This is actually a study that was published in Advances in Skin and Wound Care by Drs. Niezgoda, Sordi, and Hermans, which looked at using Vashe for general wound cleansing and 31 patients in an outpatient wound center. And their results mimicked what I had seen anecdotally as well, where they found 86% of the chronic wounds were healed at evaluation, and there was a dramatic reduction of pain. So if you look at the graph on the right there, with cleansing the wounds at 30, 60, and 90 days, they had a much more robust healing rate than they did previously when not using Vashe. In addition, the patient's pain scores dramatically improved, which is also a huge win, because that's one of the biggest battles I think we all fight as wound care clinicians. Let's talk a little bit about packing. So what packing does is this allows Vashe to saturate the wound and the non-viable tissue, as well as to disrupt any biofilm and remove the microorganisms. So what you really want is, again, this mechanical disruption of biofilm, and you've lowered the body's pH, the wound's pH, to allow the body to get to the better healing cascade that it wants to get. So you would cleanse the wound just as before. You would saturate the gauze or the packing strip with the Vashe, pack it into the wound and cover, and then you would do your normal change as per protocol. But it's very useful, particularly after you've done an IND of an abscess or evacuated something like a hematoma. Because hypochlorous acid is so innate to the body's natural healing processes, Vashe is completely non-cytotoxic, and it can be safely exposed to the wound bed for a long period of time. This study was done by Cynthia Miller and Angela Moulis, and this showed the cost savings of changing your debridement protocols. And they used Vashe on a wound prior to application of an enzymatic debriding agent. So that's a question that you often get, is that can those two be used in conjunction? And the answer is yes, you can safely use Vashe with enzymatic debriding agents. So they compared that to using it with saline. And what they found was, in the control period, they had a cost of about $1,500 for debridement per patient, which is the saline and the enzymatic debridement, versus the trial period, which was down to $424. So they saved about 67%. And then the total debridement cost per wound also went down by about half. So that's huge savings, and allows you to be able to get the patients to be healed faster and move through your clinic faster, which is what everybody wants. Vashe is also used in conjunction with negative pressure wound therapy combined with installation and dwell, which is known as NPWT-ID. So these devices work against gravity, and they remove anything from the wound environment that's been loosened with the installation. So some key points to doing this. You would do the standard dwell time recommendation as per the NPWT device. You need to use a dual trackpad. And the reason why that's important is that for the single trackpad, it's a single lumen, Vashe is so effective at breaking up the necrotic debris on the wound surface and getting it sucked out that can actually clog it. So if you use the dual trackpad system, that virtually eliminates that issue. And then separately from how you may have been taught with negative pressure, you want to confirm that the hole in the foam is being cut slightly larger. So you want the hole to be as big as the lumen of the inner circle. So you don't want it to be the whole circle itself of the plastic, but the inner circle opening, you want the hole in the foam to be the same as that. This is a case series that Kathy Gallagher and her team at Christiana did, looking at length of stay, mean operating room visits, and days to closure when they compared using hypochlorous acid versus sodium hypochlorite or normal saline installation. And so in the group, they had the mean operating room visits, meaning return to OR, went from 7 in the control group to 3.2 in the treatment group. The length of stay dropped dramatically from 25 days to 14 days, and their days to closure was 37 down to 30 days to closure. So these are all, again, win-win when you're dealing with complex patients with complex wounds. You know, the risks of anesthesia, repeatedly exposing patients to that length of stay, they get hospitalitis, they get delirium, and all kinds of other horrible issues. So this just shows the outcomes that you want to have in your programs. The National Pressure Injury Advisory Panel released new guidelines in 2019. And what they talked about was using cleansers with hypochlorous acid. And they commented on it in very positive ways. And on page 238, the guidelines state that antiseptic cleansing solutions for use of the wound bed include superoxidized solutions with hypochlorous acid. You should definitely consider that. And that cytotoxicity of cleansing solution may be concentration dependent. So it's really important that, you know, that they understand that just because you have a solution that can kill all the things, that's not good. You're also killing the healthy things, and that Vashe as supplied is non-cytotoxic. And so they even made note of that. Recommendation number 12 states that using a cleansing solution with antimicrobial to clean pressure ulcers with suspected or confirmed infection is recommended and should be done as part of standard practice. So that is just a huge overview of using Vashe wound solution in your wound care program to treat these wounds. We need a solution that helps us clean wounds as we would our hands or ourselves, but we need something that's as safe as saline and has the mechanical ability to remove these microorganisms rapidly while impacting biofilm, slough, and necrosis. And it's been really fun talking to you about this, but let's get into the heart of the matter and talk about some cases. So it's my pleasure to introduce Allison, who is now going to go through her experience with using Vashe and some of her clinical cases. Thank you so much. Allison?
Thank you very much, Kara. I am so looking forward to showing you guys all my clinical experiences with Vashe. I've been using it for the last year and some, and I've actually had some successful applications to diabetic wounds that I've been seeing here up in Canada. I am so pleased because, as Kara mentioned it is so safe. I know my patients are unharmed, and it definitely really cleans like you mean it. So let's get into our first case that I have here. This was a 58-year-old man, construction worker with type 2 diabetes. Unfortunately, boots a little too tight, rubbing, causing some blisterings, which ended up becoming an ulcer. After the OR, where he had an incision and debridement and a normal, regular negative wound pressure therapy system applied, I actually ended up switching him to an installation therapy system. So at first, prior to application, the wound measurement was 3.5 by 5 with a bit of a 0.5 centimeter depth. So as you can see, here's an application picture of the installation therapy that I used with the machine, so you can see how it is set up. When I did set it up, I used 10 cc's of Vashe to instill into the wound every 3.5 hours with a dwell time of 3 minutes. I did protect the tendon as well with an interface, mostly from the foam itself, as I had no concern with the installation of the Vashe having any effect upon those sensitive tendons within the wound bed itself. And basic negative wound pressure therapy, we changed it Monday, Wednesday, and Friday. So the patient was discharged from the facility here after 5 days, and you can already see it's clean. There's red, beautiful granulation tissue. The wound has come in through the sides, and it was measured to be about 1 by 3 with absolutely no depth. Now the next case, 53-year-old male, type 2 diabetes again. He was actually a taxi driver. When he came in, the wound was terribly necrotic. It was infected, it was odorous. He went to the OR, but unfortunately they weren't able to fully cleanse and remove all the necrotic debridement. I thought this is a perfect case that I could start to use the Vashe on there. Instead of the installation therapy, I decided to do a 10-minute compress soak. I wanted to make sure that those tendons and all the exposed underlying structures were safe. And you know what? This is truly a powerful mechanical removal of debris. All of this necrotic tissue had to go, but it needed to be done safely. Initially, the wound was measuring 7 by 9 by 7 with 1.5 centimeter depth. I applied the compress for about 10 minutes prior to then putting the negative wound pressure therapy system on. Just before discharge home after 4 dressing changes, you can see that there's some beautiful granulation tissue forming at the base of the wound coming up towards the proximal end. Some of that necrotic tissue is still present, but the majority of it is gone. It has actually been able to be lifted and removed and has been safe for this gentleman's foot. And actually, I did end up sending home the remainder of the solution to the community care nurses with instructions to continue on cleansing his wound. And when he came back for follow-up in our outpatient clinic, about a month later, you can see that there was full coverage, no loss of any part of his foot. He had no detriment. He was able to walk in with his offloading device for his foot that we had put him in. It measured about 6 by 5 with no depth. And he actually went on to fully heal with no detriment, go back to his work, taxi driver, normal as he could be. But I'd like to thank you for sharing my cases. And I know Kara has an additional case that she'd like to present with you. So take it away, Kara.
Okay, man, Allison, I can't believe that both of those patients did so well. I mean, it's a true testament to the power of the molecule, right? You know, there's so many places where for sure the second case would have been an amputation, and you guys saved that guy's foot, like incredible. So let's talk about my nightmare. This was a patient that I treated in 2018 for about the whole summer. It was a 57-year-old who had an acute lymphocytic leukemia, which had actually given him metastatic lesions to his spine, and he became a paraplegic at T8 from the cancer. And so they did a tumor debulking and a resection, but unfortunately the paraplegia was there and not reversible. So he was in the hospital getting really intensive 5-day intravenous chemotherapy courses, and unfortunately sat up in the chair as a new paraplegic for too long, and also with an immune compromised system with a white count of like basically 1, totally neutropenic. And this pressure ulcer, unsageable pressure ulcer that you see there on the left happened. And, you know, this was like a huge nightmare because we just, you know where this is going to go, right? Then the patient was on his second round of chemo. We were treating everything, but his anus was actually really, really close to the edge of this wound on the right-hand side, kind of like right at the edge of the wound in the apex or the cleft is where his anus is. And so he was having a lot of trouble with diarrhea as a side effect of the chemo, and the eschar lifted over time and he started pocketing stool, which was a huge nightmare because of course, when that became obvious as a huge problem, he had just started cycle 2 of his chemo. So we actually had to end up stopping the chemo briefly so that we decided it would be safer to open everything up in the operating room so that then at least he wouldn't pocket stool and we could deal with how we were going to, you know, treat the wound from there. So we elected to do that, held his chemo for 24 hours. He went to the OR and we opened everything up, which is the picture you see on the left. He was not able to be diverted at that point because of the chemo ongoing. He wouldn't heal. We were feared that he wouldn't heal the ostomy with his really fragile state. So we decided we were going to start negative pressure wound therapy. And so we did that using the installation and dwell technique, as you see here. So my theory was that if I could essentially wall off the lower 1/3 of the ulcer with a series of Eakins rings and ostomy paste, which you can see we just kind of like unrolled it and then made a dam, that we could then use installation therapy for the patient. And at that point, we used the single lumen trackpad, but it would have been more effective with the duo. And then we bridged everything out to protect his skin from there. So you can see that's just kind of how that went for that patient. We did this therapy Monday through Friday, and then we actually changed him back to more standard negative pressure wound therapy with the black foam on the weekend in case there was some sort of malfunction. We just were so fearful about his fragile state, because if we didn't treat his cancer right then and there, he was definitely going to die from that. It was a very aggressive cancer, but we also didn't want to treat his cancer and then have him die from complications of this wound. So as you can see, we continued to work with this, and he would get slough and challenges, but we were able to continue to get improvement on the wound bed itself. And eventually he was able to get diverted, I think between his 3rd and 4th cycle of chemo. And so this kind of illustrates my wall technique that I was talking about, or the dam, where I walled everything off. And you can see that the really necrotic tissue on the right hand of the picture on the left. But using the Vashe, it was so effective in combination with the installation and dwell system that I could essentially do the debridement of that remaining tissue just by taking my hand, and it just kind of fell off and wiped off from there. So fortunately for this patient, he did survive his cancer. He ended up going to a long-term care facility. So I was not able to see him back in clinic, but I do know that he followed up with oncology about a year later, and his cancer was still in remission. And although he still had a wound, it was much, much smaller than it was. So we considered this a big win, out of a terrible situation, which easily could have gone elsewhere for this poor patient. This is just another example of where you can use Vashe, even if it's in a more temporizing situation. This patient came in with a severe sepsis, and it almost had kind of like a scalded skin or a toxic shock syndrome, necrolizing epidermolysis, goodness, tripping over my words, situation. And the patient was just draining like crazy, and we needed some antisepsis and exudate management before we could transfer the patient to a burn center, because this is essentially what his wounds were going to become. So we simply did Vashe moistened Curlex and was able to do that, and then wrap everything in chucks and keep him safe and keep the bacteria burdens lowered until we could get him transferred to the burn unit across town. So with that, Allison and I would be delighted to take any questions that you might have. As you can tell, we have a wide variety of experiences with using Vashe in both the inpatient and outpatient setting, as well as the home care setting. And we would be delighted to talk to you more about it. Thank you so much for your time.
Thank you, Kara and Allison, for that very informative presentation. And we're about to go into the Q&A portion. But first, we'd like to ask you, our audience, a few questions about your experience and opinion. So we're going to launch 3 polls here. So here's our first one. And the question is, what are you looking for in a wound cleanser? Is it efficacy that kills bacteria, spores, and removes biofilm? Is it safety, safe on the wound and can be used anywhere in the body, or both? So give everyone a few seconds, usually about 30 seconds to respond to that. And then we'll take a look at the results.
This question is so interesting because, it really goes to show you that you need to have, efficacy and safety and, all of those things there. So let's see what you guys think as far as the wound cleanser and why it's effective. Yeah, look at that. 89% said both, and totally agree, because, how many cleansers can kill spores and remove biofilm, and it can be used basically anywhere on the body? It's very, very few. So I think that's another reason why it's a slam dunk product, that it's just so easy and, it does so well with these complex wound patients.
Wonderful. Okay, so we're going to do our second poll. So this next question, do you believe that having skin-friendly pH can make a difference for wound healing? Yes, no, or are you unsure?
So yeah, I mean, again, look at that. We talked about this in this webinar, that a skin-friendly pH makes a huge difference. If you used a sodium hypochlorite solution, which is a pH of 10, it actually takes double the time that you would, need to be effective as a cleanser and an antiseptic versus having the skin-friendly pH. And I use that as a teaching point all the time, particularly with my surgeons who don't know anything except for dakens. And then once you explain it to them, they go, "Oh, that makes so much sense. That makes total sense." And the proof's in the pudding. You see it over and over and over again with your patients, like how much better they do from just getting the pH to the level where the wound can go on to do the normal aspects of healing where it's been stalled out before.
All right, and here's our last question. So how are you planning to use Vashe wound solution in your practice? Soaking, packing, insulation, all of the above, or maybe not sure yet?
It's great to see that a lot of you are thinking about soaking, and all of the above is even better because it is true that Vashe can be used in every single one of these situations. So it's a multifunctional solution for cleansing, which is absolutely wonderful.
All right, so thanks to everyone for responding to that and providing your feedback. And now we're going to start our Q&A session. And just as a reminder, you can type your questions into the questions box there, and then we'll take a look at those. In addition to Kara and Allison answering your questions, we also have Dr. Debashish Chakravarthi, Medical Affairs Director at Urgo Medical North America. So welcome.
Thank you.
All right, so we have some questions that have already started to come in, and our first question is for Kara, and it's, what is the difference between hypochlorous acid and a sodium hypochlorite solution?
So I alluded to it on one of the poll questions, where the sodium hypochlorite solutions have a pH that is much more alkaline and even can have a pH of 10. And that actually doesn't kill in the manner that you think it does. And in fact, it creates such a hostile environment that you're killing all of the healthy tissue that should otherwise could otherwise live and help promote, proliferation and get you out of the inflammatory phases of healing. So it makes a huge difference to have the skin-friendly pH because it lowers it down to the healing levels of an acidic wound environment, which is where we know wounds do the best healing.
Okay, and let's see, we have another question. What is the shelf life of Vashe?
So the shelf life of Vashe is actually 18 months, which is fantastic. It gives it, if the patients don't use their entire bottle, during an initial wound, they have something they can keep in their medicine cabinet. I will say I have a bottle of Vashe in my medicine cabinet for when I feel like I'm getting a sinus infection or a cold, and I will gargle with it. Put your earmuffs on, Dr. D. It really is quite effective and can have an 18-month shelf life, which is great.
Okay, and we have a question for Allison. What about daken solution treatment? And I know she's having a little bit of bandwidth issues. So.
Dakens is quite harsh to use. So I was going to say, daken can be really harsh, especially on the skin. It's not as safe. You definitely get a lot of efficiency using it in treating the biofilm and the bacteria that may be growing, but it's definitely not going to help you out in the long run with protecting any of that healthy, more underneath granulation tissue that might be forming. That's why Vashe is such a safe solution to be using, because you do get the efficiency and the efficacy using it at the same time.
Great, thank you. And let's see, we have a question for Kara. Is there any advantage to using this with pseudomonas? Sorry if I pronounced that incorrectly, pseudomonas in wounds?
Absolutely. That's one of the most awesome things about this molecule is that it is so effective at killing really hard bacteria. Pseudomonas is like my worst nemesis. Give me a MRSA wound all day long, right? Pseudomonas is just so insidious. And so if you can use something like this to counteract it, you are having less antibiotic use with these patients. You're getting less antibiotic resistance. because it turns so resistant to Cipro very quickly, and then you're only left with intravenous antibiotic options. So it's fantastic for using with multi-drug resistant organisms, as well as things like Pseudomonas.
And Kara, I think this is a follow-up question to the shelf life, which is, I think it's once you open it. I just lost the question.
So once it's open, it's still actually, the molecule will remain stable in the blue bottle for up to 18 months. You know, you'd have to obviously refer to your own institutional policies about what they allow you to do once things are open, but the solution itself remains stable for 18 months.
All right, and let's see, Allison, if used as a packing, how long do you leave it in place?
So I would leave it in place the same as I do with my routine packing, which is 24 hours. So I would soak the packing prior to then putting it into the tunnel of the wound that you're utilizing it in, and then I would just change it the next day at your routine guidelines that you use within your facility.
All right, and Kara, let's see, can it be used on a baby?
So I have used it on neonates. We have a NICU in our facility, and I'm a family practice nurse practitioner. So yes, I've safely used it on a baby. And there's some question that a friend of mine, actually, who's a certified pediatric nurse practitioner, I had asked her about using it inside a humidified environment. And we would do the same sort of thing with the soaks on the skin. And just leave the doors to the isolette open while we were doing it, and then you know, go back to a different dressing from there. But it was completely safe on neonates.
And then we have a question around, could you explain how to use Vashe with VAC or VAC again?
So I can take this one, Allison, since that was the case that I showed. You know, essentially, when you do the instillation therapy with a VAC or negative pressure wound therapy, you need to have a solution to, you know, make it an effective treatment. And using Vashe, it's such an effective molecule that breaks up the debris on the wound bed and the fluff and the fibrin that's there. It works very effectively as the solution that you're using, and you get the added benefit of it removing biofilm and just really treating the wound. If you use something like a saline, it's not going to do all of that. You don't have any sort of antiseptic benefit from using the saline itself. So that's why my preference is to always use Vashe whenever I'm using instillation therapy.
All right, let's see, here's one for Allison. What can you not use Vashe on?
I haven't come across anything that I would not use Vashe on. It is quite safe. You can use it in the eyes, the mouth, the ears, the nose, any wound that you may have on the body. I feel safe using it in any situation, and at the moment, there's nothing that I would not use it on.
Okay, and then just another question for Allison. How often must it be applied to help remove the biofilm?
So the clinical studies have shown that the hypochlorous acid begins to react with biofilm as little as 3. However, it's at the 7-minute mark that it really starts to penetrate the biofilm. Now, in my case study, I decided to play it safe and do a 10-minute soak just to make sure that I was really getting the best results that I could possibly get for my patient.
Okay, and I'm not sure if we're kind of winding down on the questions here, so if anyone still has questions, please go ahead and type those in, and maybe in the meantime, Dr. Chakravarti, do you have any comments?
No, I think the questions are spot on and the answers are exactly that they need to be. Several questions on the difference between hypochlorite and hypochlorous, and I think Kara nailed it. They sound similar, hypochlorite, hypochlorous, but they're completely different. One is a charged molecule. The hypochlorite is a charged molecule. Is not really good at killing germs and terrible for fibroblasts and keratinocytes, as they have said. The other one is a hypochlorous acid, which is a non-charged, undissociated molecule. It's not a cation, it's not an anion, it's uncharged. It's lethal to the microbes. And from an evolution perspective, humans have evolved to use hypochlorous acid to kill germs. And it lives within us without harming us in homeostasis. So we have basically bottled up what is present in cells in a very pH monitored, stable form in a bottle. So that's why when Allison uses it on every possible wound, I nod my head and say, of course, it's a very quick product in terms of its efficacy. It does its thing and it moves on. There's no residue behind, like a synthetic antimicrobial molecule, such as PHMB and things like that. So very, very cell-friendly. That's all I would like to add. Thank you.
Wonderful. Thank you so much. And we've got a few more questions here. Let's see. So this might be for Allison here. Can we get the Vashe at pharmacy, or where can one purchase that?
So Vashe is just coming to Canada, and I'm very excited that we're going to be seeing it in Ontario fairly soon. At the moment, I believe that it's only going to be available to local distributors for the clinicians to utilize. The hospitals, the long-term care facilities, and our community care partners, I'm not quite sure that it's available at local pharmacies at the moment, but I do know that it will be available for clinicians to utilize for their patients in the clinic and hospitals.
I think the key thing,
but definitely get in touch with your local rep if you have any further questions about availability. Sorry, Kara, go ahead.
I was going to say what you said, that your local rep obviously is the best resource for you on how to get it into your facility.
And there's a question here, I believe, for Dr. Chakravarthy. Is it safe to gargle with?
Listen, that's all I drink when I watch football, you know, so no, to be on a serious note, Vashe has no oral toxicity, and it's very benign, and people do use it. It's not one of those on-label uses, you know, but it's safe for the mucous membrane, and we have done animal studies to show that it's not harmful when orally ingested or put in the oral cavity. How much of it is used that way is very difficult to say. We hear people using it for gargling all the time, and we smile. That's all I would like to say.
People are calling out some different, well, can it be used here or there? Can it be used in the ear?
Yeah, listen, you know, as long as it doesn't get into contact with your internal organs, you don't want that because the product doesn't have labeling clearance for that. So to clean the outsides of your ear cavity, it's fine. You know, people use it on the face all the time when they do facial plastic surgery because, you know, it can spill into the eye and it does nothing to the eye. You know, no stinging, no hurting, and so on. So we just want to be careful about we don't, as a company, encourage you to put it in touch with bodily organs, your internal organs. Does that make sense?
Yeah, I think then kind of related to that is, can it be used for gingivitis?
Man, you know, I think people do use it in that application. We hear about it all the time. No studies have been done, so how effective it is, I could not tell you. But anecdotal evidence comes to us every now and then. Hey, we use it, and the results are really good. But without a clinical study, it's very difficult to comment definitively in that area. I don't know, Cara, what do you think? Have people in your circle of friends using it for gingivitis or something? I don't know.
You know, I hadn't thought about gingivitis, but I can certainly see an application for it. You know, you can use it anecdotally. Again, you have to look at what it's approved for with the labeling, but I've heard it used in just about every situation that you can think of. And I will tell you that I used it on my best friend's dog to heal a wound on her tail a couple of months ago, where she had a tumor removed, and we are sure that that's what saved the tail. So that's, again, anecdotal, but it can be safely applied everywhere.
Yeah, from the company perspective, we got to be honest and tell you that it's not a oral use product on the label. But, you know, if people use it that way or accidentally gets into the mouth, no need to freak out. Everything's fine.
Yeah, I think there's a comment here, like for dementia, clean mouth. So maybe that's a use case.
Sorry, what?
It says for dementia, clean mouth.
Yeah, I know the issue. You know, it's, you know, oral health in patients with dementia is a big issue. I don't know, Cara or Allison, if you face it in your practice, but one reads about it. And there is dental decay because oral hygiene is poor and so on and so forth. I don't know if I would say Vashe is the solution to that, but, you know.
I haven't tried it for that. I really use it on open wounds, honestly. You know, we'd have to get some studies together, right?
Yeah, and you know, these are different categories of medical products. I just want to be clear about that. Yeah. What I'm answering are safety questions. If it gets into the eye, is that a problem? It got into the ears. Is that a problem? You know, it got into the mouth. Is that a problem? No. We have done animal studies to show that such kind of exposures are safe, are not likely to produce harm. That doesn't mean we are encouraging people to go and use it that way.
Okay, and let's see, there's a question for Cara. Can it substitute inodine dressings, etc., or iodoform packing?
Can it substitute for that? Well, I mean, you can use, it's great for packing. You can moisten new gauze with it. I don't know that I would use it in addition to iodoform. I would probably use a plain gauze ribbon without any other additional solution impregnated within it. So I use it all the time in that manner to do for packing. So I would say, you know, soak it in your plain gauze and then use that for packing.
All right, and let's see, usually with saline, we wash our wounds with at least 100 cc. Is that still the case with Vashe?
Well, I think it depends on the wound size, and Allison can jump in too of how much you want to use, but truly you need, you know, about a tablespoon on it for kind of the smaller wounds. I like to have I do a compress on every single patient in my practice, and I like to have the gauze very damp, not necessarily dripping. I don't think you need to do that, but definitely have the entire gauze saturated with the Vashe itself, and then you know, do a compress of at least, you know, 10 minutes on there. Well, and I do it while the patient's waiting to be seen by the provider. So when the dressing gets broken down, just like Allison was saying, you know, you do the compress from there, and so that seems to work really, really well for that amount. But again, you don't have to just pour it on and pour it on and pour it on. It really is very powerful.
Yeah, I do. Thank you, Cara. I do want to go back to that question on iodoform a little bit, because people ask similar questions with regards to silver in its context with hypochlorous acid and Vashe all the time. I do want the audience to recognize that fundamentally these two classes of molecules are different. Silver and iodine are antimicrobial barrier agents. They do kill germs, but they don't kill it dramatically fast. To get 4 logs of kill, you have to wait for up to 24 hours in most cases. Whereas with hypochlorous acid, in experiments that we do see that when you introduce germs into hypochlorous acid in the bottle, within 15 seconds, 4 logs are gone. So putting Vashe into a wound is the equivalent of putting a highly destructive incendiary device as far as the germs are concerned. But the beauty is that massive activity against germs, it's completely benign against cells. So it is completely one-sided. It kills the germs, protects the cells. With silver and iodine, the mode of action is slow. And so they need to be in the wound for a long time to do their thing. With hypochlorous acid, you get such a massive reduction in germ level mechanically through the removal process that it takes forever for the germs to come back to a level that is problematic. And you're changing your dressing in 24 hours anyways. So gradually your bioburden keeps going down because every 24 hours or so, you're giving this massive shot and just killing the germs in one shot within a matter of seconds. Does it make sense, Kara, on the difference between silver and iodine and hypochlorous acid? Allison, does it make sense what I said?
I like to use it. I think of it as dosing the patient every day with, and the antiseptic. It's just such a powerful antimicrobial preservative that's in there. And so again, I think that it's much more effective just be repeatedly dosing with these patients, whereas you use something like a silver or an iodine, and yes, you get an initial dump of it onto the wound, but then it peters out very quickly over time. So yes, it might be in place for 7 days. Are you getting the same level of antimicrobial bactericidal activity for 7 days? No, you're not. I don't know that any dressing can say that they're keeping that same level at each, consistently across time. So I think that that's why it's important to separate it out from the silver iodine-based antimicrobials, just because it doesn't have the same efficacy, and you're getting just a huge dump and killing the spores and killing the bacteria with each dose that you apply. I think of it as dosing the patients and treat it that way.
Yeah, I think you could absolutely look at it this way. To me, as a scientist and a chemist, it comes down to how quickly can you reduce germ level by 99.99%. With silver-containing dressings, I know because we have silver-containing dressings too, and silver-containing dressings reach that 4 log slowly. Okay, it takes about 24 hours to reach that, and there's some benefit to that. Whereas with hypochlorous acid, the 4 logs, 15 seconds, and you're there. So the germs don't have time to breathe. They are just gone. And so by the time they get organized and come back a little bit, it's time for you to give them the next shot again. And over time, as you go, the biofilm and the germs, they keep dropping down logarithmically, and your wound bed gets really well prepared using this technique.
Yeah, absolutely.
Well, thank you all so very much, and I think we're going to be wrapping up the Q&A and wrapping up our session. So thank you again, Kara, Allison, and Dr. Chakravarthy for an engaging talk, and we'd like to thank everyone also for attending today's webinar, Clean It Like You Mean It, Introducing Vashe Wound Solution. If you do have additional questions, please contact us at Urgo, an Urgo representative as shown on the slide here. And once you leave today's webinar, you'll receive a survey on the presentation, and we would really love it if you would complete that and provide your feedback. You will have the opportunity to sign up for future updates from Urgo Medical and to receive a starter pack with the products presented today. And you will also receive a follow-up email within 48 hours with a link to view the recording of this session. So on behalf of our presenters, Urgo Medical and Wounds Canada, thank you again for joining us, and have a great rest of your day or evening.
Thank you.
Bye. Thank you.